Hey good people, hope you're well and keeping safe. And today I'm going to talk about a topic that is very highly requested. I'm going to talk about bariatric surgery, weight loss surgery. All of you know that I had weight loss surgery in 2014, a mini gastric bypass. I didn't have it in Kenya, but today I'm going to talk about weight loss surgery in Kenya. I'm going to talk about my experience, how I have maintained my weight. I'm going to answer your questions, and before I start and talk a little bit about my experience, I'm going to introduce our doctor today. I have Professor Maleckas on set. He's a very experienced bariatric surgeon, and I'm going to let him introduce himself. Welcome.
Hello to everybody. I am Professor Maleckas. I work as Professor of Surgery in Lithuanian University of Health Sciences, and Lithuania is Europe. And also I'm a lead bariatric surgeon in North Clinic in Lithuania, and also lead bariatric surgeon in Nairobi Bariatric Center here in Kenya.
In Nairobi.
In Nairobi.
Yeah, so he is affiliated to the Nairobi Bariatric Center here in Kenya. And all of you always ask me, where can I have weight loss surgery? And I always direct you to the Nairobi Bariatric Center. Why? Because they give quality care. They always focus on the patient. They are affordable. And today we are going to talk about the process, and I'm going to answer your questions. So I'll start with myself. It's been 7 years post-surgery. I was able to lose 30 kilos and 33 kilos, and I've maintained it for 7 years. I did a mini gastric bypass, and people normally ask why. It's because I struggled with weight for so long, for 10 years, and I had high blood pressure, and the only permanent solution for me was weight loss surgery. And like I always say, I have been able to maintain my weight because I have been able to change my relationship with food, and you're able to do that through psychotherapy, which they offer at Nairobi Bariatric Center. And also just to remember that weight loss surgery is all about controlling your portions, controlling what you eat, ensuring that you eat a healthy diet, ensuring that you maintain your portions, and approaching the surgery with a positive attitude. And so today I'm going to ask all the questions you guys have asked me, and then I'm going to talk a little bit about the Nairobi Bariatric Center. Doctor, many questions that people ask is a surgery risky? From your experience, what would be your answer?
Yeah, every surgery has some risks, and everybody who goes for a surgery needs to know this. And I always, when I talk with patients, I explain the risk. But definitely the most what patients are concerned about is actually dying from the surgery. So the risk is extremely low, I can say, despite that this surgery is a complex one. When you're cutting and dividing and connecting the bowels and the stomach, still the risk of dying is somewhere 1 in 5,000. I think it's even lower than driving a car and dying from an accident in Nairobi streets.
That's a good answer. So the risks are very low, but like you said, any surgery has its risk, but the risks are very low. Okay. Another question people ask: what is the criteria for you as a doctor to be able to do a bariatric surgery on a patient? What's the criteria?
Yeah, it's standard international criteria. It's set already like 20 years ago, and there is based on body mass index.
BMI.
BMI, yes. Surely you can discuss if BMI really reflects your need to do a surgery or not, but this is another story. We go only for the numbers. So BMI, if you have over 40, so then there is already an indication to do a surgery, despite that maybe you are healthy now, but it will take maybe short time before you get a diseases associated with a surgery like diabetes. And then even if you do a surgery, it could be not that beneficial. So it's good to do surgery before you get the diseases, so this BMI over 40. And also we can do surgery for those who has BMI between 35 and 40, but then it's prerequisite to have some comorbidities or other diseases that are associated with your obesity. That means like high blood pressure or diabetes or arthritis, or some sleep disturbances like sleep apnea, or even for a woman, infertility.
Okay, so that is a patient who you would recommend bariatric surgery. When you talk about bariatric surgery, do we have, what options are there? Do we just have, I know I did a mini gastric bypass, but what procedures are there now?
they are similar like it was when you have been doing surgery like approximately 8 or 10 years ago. There is gastric sleeve, there is mini bypass, though it's not exactly correct name to mini bypass. It's one connection bypass actually should be said, and it's a classical bypass. This is the most common and most popular procedures that are done currently.
Okay.
And actually the sleeve gastrectomy is #1 in the world, but still it's a procedure that is done about 10 years and we do not know long-term results. Gastric bypass, be it one connection or it's classical bypass, is done much longer, and we know that it works under long time. The patients may maintain the weight, and the sleeve still we have some questions, but it's also a good operation and it's comparable to a gastric bypass.
Okay. How long would you say, and every patient is different, the surgery can take?
The surgery, it depends actually upon the expertise of every surgeon, so and the complexity of the surgery. So if you take gastric sleeve, is somehow a little bit easier operation for the surgeons to do, and then it may take a shorter time than gastric bypass is a more complex procedure. But with expertise that, for instance, I have, all these procedures take to do between 45 minutes and 1 hour.
So it's not a long procedure. It's not a long procedure, is it? And it is laparoscopy.
Yes, this done with the keyholes, small incisions, 5 small incisions, which facilitate much faster recovery and return to daily activities. And usually already after a few hours after surgery, the patient can stand.
You can walk.
Can walk, and also they are discharged on the day 2. And after approximately 2-3 weeks, they return to usual daily activities, and they are feeling not like operated.
Okay. What would you say is the success rate so far in the many years that you've been in the field with your patients?
It's a very good question. What we define what is success rate, like if the patient look like you, or we are saying, okay, some amount of weight they lose, or how they feel. Yes, and so still there is no good definitions for success rate. I think personally that the success rate should not be defined only by the weight, how much they lose, but by how they feel, what comorbidities they had, and how they were treated, and how much health the patient got, and how the quality of life was affected. Because if you really lose, some 30 or you lose 40 kilograms, but if your quality of life improves, so maybe it does not matter if you lose 5 kilograms more.
Okay. True. So it's true what Dr. is saying. It's all about, it's not necessarily don't focus too much on the weight. Yes, if you lose weight, it's good. But then again, did you reduce your high blood pressure medicine? Some people even get off the medicine completely. Some people get off sugar drugs completely. You live a good quality of life. You're more lighter. You exercise. You're feeling great about yourself. You're feeling great about your body. So that's what we mean by success, not necessarily the number on the scale. Another question my audience had was, what are some of the, you can't necessarily say side effects, but what are some of the challenges once you have the surgery? For example, we know you can have gallstones, you can have acidity, acid reflux. What are some of those issues that you'll have to deal with after the weight loss surgery?
Yeah, definitely. This is always, when we talk about surgery, we need to understand that there are some risks, immediate risks. I mean, after surgery, and we were talking about some risk of death, but also there are some immediate complications like bleeding or some leakage that has to be corrected or reoperated. But also there are long-term side effects that can happen, and I completely agree that some of them is connected, for instance, to acid reflux, and this is more common after gastric sleeve than after bypass, really, because after sleeve approximately 30 to 40% of the patients may have an acid reflux and need to take medications continuously. But also it's very important before the surgery to explore if the patient has an acid reflux. So if they have an acid reflux, so gastric bypass is a more better procedure because it can cure the acid reflux. And if you do a sleeve, you can continue to have even a more severe reflux. So this depends a little bit upon the choice of the procedure. Other side effects also, they are more general, like some deficiencies in vitamins and microelements.
Yes.
Because you need to take continuously, and this is especially for the women of fertile age. I think everybody knows why, and they need to take more of the iron, because you cannot get enough of iron with the food. So you need to take a supplements, because otherwise, if you're not doing this, you will definitely develop an iron deficiency anemia. So this is one of the things you have to look after. And also on the long term, what is important is like calcium, vitamin D, because it's very important to look for your bone health. Bone health, you do not see the changes in bone health immediately, but you can see them after 10 or 15 years when you get more fractures. So it's very important to be serious with all these supplementation. And also, as you mentioned, gallstones, yes, but this is not exactly specific to a surgery. This is more specific to a rapid weight loss, because even if you go on a diet, you can rapidly lose the weight and you get gallstones. But there is a risk of getting gallstones after sleeve and bypass, approximately the same. About 20% of the patient can get gallstones, but those who need taken out of gallbladder, it's approximately up to 10% of all patients. So this is not a really big issue, but definitely is there. How you can influence this, you have to drink sufficient amount of water, and there are specific medications. So sometimes you can be prescribed to reduce the risk of getting these stones, but these medications also have a side effect. So usually I recommend for the patients taking more fluid or water while they are losing a lot of weight.
Okay. So I personally, my experience, and like he said, like with the bypass, I haven't experienced gallstones, touch wood, 7 years later. I do suffer from iron deficiency, and even the Dr. Shukin was reminding me to go take my supplements. You have to take your supplements every day because you do have some deficiencies. So that's something that I'm also facing. But other than that, 7 years later, no gallstones, I don't have any acid reflux. And to be honest, I can say it was worth it. Would I do it again? Definitely yes. There's also another question my audience was asking. Does weight loss surgery affect fertility? For example, for a woman who's not yet have had children, so they wonder, okay, should I do the surgery before, after children? So what would you say about that?
Yeah, it's a question that often is asked, but I would say that way, that the weight loss surgery improves fertility, and this for sure. Because adipose tissue produces a lot of estrogen. It's a hormone that reduces fertility. So after the woman is losing weight, the fertility improves. And even those women that suffer from infertility, they can get pregnant, and this is shown by scientific studies. Another part of this question actually is about impact on the offspring or the baby that you'll bring. So this is also a question that is very important to understand, that is connected to taking microelements, supplementation, yes. And then what is known is also that you, by losing weight, by doing surgery, you improve the health of your offspring, because you reduce the risk for your baby in the future to have obesity. And this is shown actually already like 20-30 years ago with the studies from Canada and US, when they have taken the same woman that have been obese and gave birth to a child, and they had gone through the operation and gave birth already after operation to another child, and they compared these two children, one that was born before the woman having a surgery and the other one after, and they found out that the risk of having obesity in the baby that was born after surgery is much less than in the baby that was born before having a surgery.
Interesting.
Very much.
Very interesting. And what about weight gain? Because some patients do tend to, how do I say it, gain the weight back and might have to do a second surgery to fix the whatever was done before, and they have to repeat the surgery. What about weight gain? Because some people are not able to maintain the weight loss after a few years. Do you have patients? Have you seen such patients? And what would your advice be?
Yeah, I have seen, and I have seen, I must be honest, I have seen pretty a lot. We looked back home where I'm professor of surgery at our patients that we operated with gastric bypass 12 to 15 years ago. And actually we found that about 25% of them regained more than half of the weight they lost. But interestingly is that when we compare those who regained the weight with those who are stable on the weight, the only difference we found is actually was not the size of the stomach, because sometimes the people are thinking that they stretched the stomach.
Does it?
No, it was not, because those who were gaining the weight and those who were stable on the weight, they had the same size of the stomach.
So the stomach doesn't.
So stomach does not change and does not affect weight regain. The only thing were actually snacking. Those who were gaining the weight, they were taking snacks more often. And more important, they were choosing like berries, nuts, chocolate, milk products. The products that is calorie dense and can easily go even through the small stomach. So here is very important to change your mindset, attitude to the food. And this, I think, psychological help from the Nairobi Bariatric Center that is given is very important, and will encourage patients also taking the whole like package surgery with psychotherapy in order to change all this and to avoid or reduce the risk of possible weight regain.
The doctor is saying the truth. For I personally myself, what has changed is my relationship with food. So I think the psychotherapy part of it, and that's what Nairobi Bariatric offers, is just not the surgery itself, but the psychotherapy, which is done follow-up after the surgery, and you do it for a period of 4 months. And psychotherapy really helps. It helps you have discipline around food. Like the doctor has said, I'm really careful with what I put in my mouth. Number one, because I don't eat too much, I eat small portion. It has to be nutritious. I stay away from calorific dense food. For example, I don't do dairy, I don't do very fatty foods. So I ensure, because I'm taking little, it's nutritious, and I'm also very careful to be snacking healthy things, because you can sneak in snacks and it's small amount, but the calories are a lot. So the relationship with food is key, and Nairobi Bariatric Center offers you that psychotherapy. I will honestly tell you the truth, I didn't have that. I think for me it's resilience, and I trained myself, but that's what Nairobi Bariatric Center offers. And also it's way more cheaper to have surgery here in Nairobi. There were no those options then 8 years ago when I had surgery, and that's why I went outside the country. But now it's way more affordable. You don't have to pay the ticket. When I was there, I had to stay there for 3 weeks, so there was accommodation, aftercare. I really struggled to get even a doctor to go for aftercare, to go and check my vitamins, to go for my second, third post-op appointment. So I didn't have that. And I remember even trying to talk to the doctor on the phone and be like, are you okay? Do you have any signs? Do you have any stomach pains? And there was no doctor for me to go for post-op. So the thing, if you do have surgery at home, you have all that post-care, you have psychotherapy, and that really helps you maintain your weight. Another question that I'd want to ask after, let's say I want to try for a baby, I've done the surgery, everything is okay, it went well. After how many months can I start trying to conceive?
This usually considered to be like 1 year, 1.5 years. Why? Because you need to stabilize your weight. To stabilize weight loss, when you're stable, you take sufficient amount of nutrients, the body is prepared, you can become pregnant. What happens if you become pregnant early? Actually, there is no data that it's something dangerous for your child or for yourself, but it could be a problem in losing the weight, because you know, when you're pregnant, you change some eating habits, okay, you know, attitude to food, and maybe you will not get the whole benefits from the surgery that you can have.
Okay. Also another question is, what about I've experienced it myself, dumping. Because myself, if I eat something that is not fatty but very sweet, like I can't I don't eat cakes. I don't eat cakes, I don't take soda, I don't drink juice, I don't drink anything with a lot of sugar. What is dumping? And I don't know if that's the right name, if I'm using the right.
I think you are using right, because the dumping is something that is connected to light carbohydrates, so sugars. However, if you eat too much of them, you get a lot of sugar coming into the bowel, and then you get the effects of this. What are the effects? And the blood and the sugar in the blood increases, and you get also some effects on the bowel, like you can have some pain, or you can have some loose stool, sweaty, yes, because of a lot of sugar is coming into the blood. And then you get, more interestingly, you get also the afterward effects. And these afterward effects is a rapid decrease in the sugar in the blood, because at first you get a sharp increase, then sharp decrease, and you get a hunger sensation. So the dumping syndrome in itself shows that something you add is wrong. So
to control.
Yeah, and some people consider that this is a good, dumping is a good because it protects you from overeating or eating food that is not healthy.
Yeah. So for me, to be honest, it is control. So whenever I can't even have, even on my birthday, a little cake, I just have a little, because then the effects, it's not worth it. So it helps me control. So that is one of the benefits for me. I don't know for other people, but yeah, for me it is control. Also, what about excess skin? Because we all have, for example, someone has lost 100 kilos, someone has lost 50 kilos. I lost that in my case, and I went to the gym, and I didn't have a lot of loose skin. So what about if I have loose skin? Because then that's a problem. Then I don't look the way I had imagined. Yeah.
This is a good question. Actually, what we need to know about the skin, that unfortunately the skin, if it stretches, it does not come back as it was before. And the skin is not that elastic that if you lose the weight, it comes back and you look like you have been, 20 or 30 years ago. This is not that, but it has some ability to contract, and it depends how much of folds, skin folds you had, and this will depend how much loose skin you will have after surgery. So a little bit before surgery, looking at some patients, you can predict. So, and when you, but in this case, it's already that you may need some body contouring surgery to take away that excess skin. When you can do this, usually is recommended to do about 1.5 years after surgery. Why? Because when your weight loss is stabilized, this is about 1 year after surgery, still the skin contracts a little bit. So about 1.5 years after surgery, you can see already the situation, real situation, how it looks like, and it's stable. And then you can consult a plastic or reconstructive surgeon to see what can be done, because here it's very important to see, you'll have some scars, and how much of the loose skin is it worth doing, or you have to accept this as it is.
Yeah. Okay. So I personally waited for 2 years before I did my tummy tuck, because I had loose skin here. It's the only thing I had. For the arm, it wasn't worth the scars, so I live with it. So it's like the doctor said, wait for a while so that you have maintained the weight and you're stable, now you're at a stable weight, before you go for consultation with a plastic surgeon. Another question, something I wanted to mention, is that when you do the surgery, it takes a while before you can eat solid food. And for me, that was the hardest part. I had to stay 14 days eating liquids, drinking liquids, and I was in India, and it was dal soup, and I remember I really used to cry. I really used to crave food because I was used to eating. So maybe you could talk a little bit about that. I actually shed tears.
Yes, this is like this, and you have to be actually on liquid, but you can take some mashed food also. We allow taking baby food from 4 to 6 months, and the patient can start already on the 2nd or 3rd day before they try yogurt, if the yogurt is good. So they can have a little bit more choice than only the soup and the tea, I understand. But this is a little bit the attitude, of different centers. But from our side, it works well with the baby food. because the patient also needs a little bit more nutrition. But I completely agree that even if you take a baby food, you have to be very careful. Very careful. What does it mean? You have to eat extremely slow, like 100 milliliters, 20 minutes, like teaspoon per minute, so nearly licking a teaspoon. Why? Because the stomach, or it's a sleeve, so we cut the stomach, there are sutures, or be it bypass, where we cut the stomach and connect to the bowel. There is still sutures that do not heal immediately. It takes time. It takes about 4 weeks until these sutures become sufficiently strong. And if you eat too much, maybe you throw up, then yes, you can stretch too much, and unfortunately you can get sometimes even some rupture, so you have to be really careful. And one of the things I think the surgeons, so it's a little bit upon you know, the surgeons, how they look at this situation, and that's why they offered for you only a fluid, just to be on the safe side, not getting any severe complication. You have been abroad. So.
Yeah, and because I was coming home and I was far away from home, which is also the benefit of doing the surgery at home, because in case of any of those things, then it is easy for you to get the needed care. And in case of any of those questions, and that was my struggle, I didn't have anyone to ask questions. And so for me, if I felt like vomiting, I knew I've overdone it, you know, it was part of my control. But I think doing surgery at home, where it is easy to get in touch with the doctor, do the consultation, ask questions, because to be honest, I was really clueless. I did a lot of Googling and joining Facebook page of patients who've done bariatric surgery in case of any issues I had. So I think I'm so happy that this surgery is readily available in Nairobi. How long before you see the results?
It's pretty soon. Yeah. I mean, you're losing some kilograms even in the hospital or leaving the hospital. And the first month is really the month that you're losing pretty rapidly the weight, because of the liquid diet, semi-solid diet, whatever. So it could be like 8 or 10 kilograms, and then you lose less, because you start already after 1 month, you start taking a more normal food, but you have to chew well, to eat slowly, and then you lose maybe 3-5 kilograms on average, and continue to lose up to 1 year about. And it depends how much overweight you had before and how many kilograms you can lose, definitely. So for one, it could be enough, like for you 30 kilograms, for the other one maybe 50 to 60 kilograms. Yeah. But results you see pretty early, and even I could say that we also have a program to prepare the patients for the surgery. And already with this program, the patients are losing some weight before the surgery. Why? Because it's very important. You can reduce some risks associated with the surgery by losing the weight and preparing you. And also, again, depends on how much overweight you have, because the more overweight you have, we ask to lose more weight before the surgery to be easier to perform the surgery.
Okay, and that is what I was going to go straight to. I wanted to ask that question. So for example, I want to go to the bariatric center to lose weight, yeah? You just don't walk in and say, hi, I'm here, let's go do the surgery. There is a procedure, there is a process. So you do the consultation with the doctor. Maybe you could give us a brief of that process and how long it takes, so that patients understand that I don't just go and say, I'm here, let's go to surgery. So I come see you, you do a consultation. Maybe you can give us a brief of that.
Yeah, it's usually a process. So first of all, in our center, definitely the patients come and meet our Dr. Ludmila Shchukina, and she is really very good in psychotherapy and diet. So she explores the various risk factors and see if the patient really meets the criteria for a surgery, if the patient meets criteria for the surgery, and which are the criteria. This is body mass index 40 or body mass index 35 with comorbidities, and the prerequisite condition is that the patient tried to lose the weight before, that they know what is meaning to be on the diet, restricting yourself, and so on. So if you fulfill all these criteria, then you have a consultation with me. Not always I'm in Nairobi, so you can have also an online consultation. And then if everything is okay, then we are scheduling the operation time, and then starts preparation before the surgery for It could be a psychotherapy also before the surgery that continues after the surgery. It could be that you're on the liquid diet only to lose the weight and you can take psychotherapy afterwards. It depends, you know, so this is the process, how it looks like.
Okay. So at least now you have an idea. And also another question was the cost, and I think that one I will direct you to the website. Just remember, like I said, and I'm not saying this out of favoring Nairobi Bariatric Center, it's cheaper to do your surgery in Kenya, people. It is cheaper. It's just then because when I did it, there was no bariatric surgeons here in Kenya, but it's cheaper to do it in Kenya. It's more affordable. Like I said, the nursing care is here, the doctor is here, you have one-on-one, you have psychotherapy sessions afterwards, so it's cheaper to do the surgery in Kenya. And why would you go to Kenya when we have qualified, talented doctors, experienced doctors here in Kenya? So if you want to know more about the course, it's on the website. And as usual, I always just say, please book a consultation with the doctor instead of Googling and DMing me. And please, if it's something you really want to do, book a consultation with the doctor and they will answer all your questions. And again, it's a process. They work with you, they hold your hand. It's a journey. And so before I conclude the video, I wanted to talk about the surgery and the procedure. That it's just a tool. I like calling it a tool where it helps you now to start losing weight, but it's up to you to maintain it. Maybe you can talk a little bit about that.
Yeah, it's completely correct, because this is a little bit of the mindset, how you see the surgery itself. Because some of the patients, they're coming and thinking, okay, I'll do a surgery, my problems will be solved. But unfortunately, obesity is everywhere around us. What I mean is in the genes. Why is in the genes? Because we all, in order to survive, need to look for a food. And that is in our environment. Why? Because food is now available, and the food that is available, there are a lot of food with carbohydrates, light carbohydrates. And then there is also in the lifestyle that we don't have enough time to sit and to eat slowly and healthy food, because we just look how we can do it fast and just run, work, come back home tired, eating. So this is obesity is complex. So you should not think that you've got an operation and you solved all the problems. Genes, your lifestyle, and you know, your mindset. This is the way you have to look, is that surgery is a good tool, and really, believe me, it's a very good tool. You got a small stomach, you cannot eat a lot, but you have to work with yourself. Not exactly work, but you have to listen to yourself, what signals are coming from your stomach. If you try to overcome these signals by, you know, eating less food, eating food that is smaller but higher or calorie dense, then you can start regaining the weight. But if you learn to listen to these signals and learn how to use correctly this tool, you'll get the effect as you see in front of you.
Yeah, my doctor, and I'm not blowing my own horn, my doctor said I'm one of those successful patients. So it is also because, you know, psychotherapy, changing your relationship with food, it's a mindset. It is changing your lifestyle. It is eating healthier. It is exercising. Remember, it's a lifestyle. It's a long-term, it's a slow burn procedure and process. So that's what it takes. I hope I've answered your question, guys. Thank you so much, Dr. for coming, and I hope you have a safe trip when you go back. And remember, people, we have the best talent. Dr. does a lot. I think he does how many surgeries in a day? Approximately
7, 8
surgeries in a day. So he is really experienced, he's a good doctor. And what I love about the Nairobi Bariatric Center is the aftercare and the psychotherapy they have. They work with the patient, the journey, you know, they help you with the supplements, they help you to be able to maintain your lifestyle, and it is readily available in Nairobi. I will link all their pages, website, Instagram, and their contact, and you can pay them a visit. I hope you benefit from this video, and thank you again, Dr.
Thank you very much.
Welcome.